morning to all. JSS Academy of Higher Education and Research welcomes Dr. Cariappa, the Adjunct faculty of JSS Dental College and Hospital. And I also welcome the students of JSS Dental College and Hospital and faculty, as well as all other guests who have joined this virtual learning session and to listen to the talk with Resurgence of oral surgery in the present scenario. Dr. Cariappa has been in academics for almost 4.5 decades, and we are very happy that he's here with us today. I welcome you, sir. And I also welcome Dr. Ravindra, the principal of JSS Dental College. And I request Dr. Ravindra to kindly introduce our speaker of the day.
Thank you, Dr. Thank you, Dr. Nandlal, and good morning, everyone. It's my pleasure to introduce our adjunct faculty, Dr. K.M. Cariappa, mentor and facilitator, Royal College of Physicians and Surgeons, Glasgow. He has completed his PG in oral and maxillofacial surgery in 1982. Since then, he has been in academics and served in various capacities. And his present assignments are: he is a mentor and facilitator, Royal College of Physicians and Surgeons, Glasgow, and postgraduate guide, Department of Maxillofacial Surgery, Manipal College of Dental Sciences, Manipal, BLS, ACLS instructor, Manipal University, and Chief Coordinator for Continuing Professional Education, Manipal University. And he has many publications, national as well as international publications, and is also an author of textbook. And he has been honored various academic awards. To name a few, one is Best Student Paper Award at National Orthodontic Conference at Kodaikanal, T.C. White Scholarship from Royal College of Glasgow, then Lifetime Achievement Award from AOMSI, felicitated at Asian Association of Maxillofacial Surgeons at Mangalore in India. With this brief introduction, I welcome Dr. Cariappa once again. Over to you, Dr. Cariappa, sir. Thank you.
Good morning. Thank you for the lovely introduction.
Yes, sir.
May I have the first slide, please? May I start the proceedings?
Yes, sir. Yeah, please.
Sure, sir.
Good morning. Let me thank the authorities of the JSS Dental College for giving me this opportunity to be a webinar speaker today. My thanks to the third years, final years, and the interns for gathering around the computers to attend this webinar. My greetings go out to the parents, pets, and other siblings if present. Now, if I have to go back to the topic, it tells us that there is some kind of resurgence in oral surgery and general guidelines for clinical dentistry in current scenario. In current scenario, yes, not too good. Why resurgence? We have been sleeping for the last 2-3 months, and getting up and gearing up for practice is a little slow, but in a positive direction. Why oral surgery? Probably the most scariest of all the dental departments, and probably the most friendly too is oral surgery. And at the same time, we have a general guideline for clinical dentistry in the current scenario. The reason for our gathering today is to get to know a few tricks in the trade that can be used in dentistry in the current time. Though the techniques used in dental specialty may change a little with adherence to the general principles, a few new tricks can be used to make it safe for the patients and the doctors treating them, as this is a contemplating time for the dentist. Everybody is scared. They do not know what the future holds. But like I said, there are a few little tricks which can be used. And these tricks are little simple ones. It's as simple as taking candy out of a child's hand. So even though we have to face the devil head on, I do not know whether it's right, but as long as we can go along the sides and achieve what we want, I think we should be fine. For that, we need to have a little alterations in our practice, in our lifestyle, in the management system, and at the same time, make sure that nobody is affected badly. Yes, of course, there are going to be a little financial involvement, but I think that's part of the game. And then, lastly, my thanks goes up to the faculty members of this institution and the senior professors who may be watching, Dr. Chandramohan and Dr. Manjuna. My good friends, I hope they are there and I hope they are well. Thank you for that. Now, when it comes to my thanks to the faculty members, I think the faculty members will be very, very busy these days. Because what is expected of them, according to the books, is that you have to keep the knowledge updated. You have to do a lot of presentations yourself, learn new tricks, publish a lot of papers, go talk alone in a room, read good books, obtain maximum literature substance. So this is going to be a little tight, but then that is what is needed. So because all this is needed, we are heading for a tough future and a lot of confusion and unanimous decisions are being taken. So all we have to do is learn a new trade, literally. But learning this trade is not too difficult, I'll tell you. Because yesterday, when I walked into the Department of Oral Surgery, I realized that the Sai was working in such a way that is totally geared up for the situation. He had all the good things that is needed in the textbook for carrying out the surgery. I was very happy. Then, as I came to the main door, I realized perfect screening was going on. Chairs were outside, lot of distances between them, hand washes, questionnaire, everything given, and distancing between chairs. Wonderful. But what happens is, when you go in further, you need to change a little of scenario. That means you probably will have to get more room inside so that you can continue the operation patterns which are slightly different, but not too different. If you have learned your basic oral surgery, this is something new for you all to learn. And learning is not too difficult. Like, if you have to go inside and wear shoe covers, okay, that's fine. Earlier, no shoe covers, okay. Now shoe covers, is that a big thing to do? Your head covers, no. Is that too big or too difficult? No. Simple things like this. As long as we can adjust a little, I think we should be fine. And at the same time, we have been blessed with a lot of celestial blessing. We have the lady on the top of the hill who is looking after us, and there is a saint also looking after us, and there is the Dargah too. So we have what is Chamundeshwari and the Philomena and the Dargah. But people say if a lady looks after the house is very prosperous. So if you have to weigh the pros and cons, the two ladies versus one gent, the ladies win. So Mysore would definitely be safe for you all to come back. So please come back because everybody is craving to come back to practice and to the college. To tell you honestly, the staff members and the college is really missing you. And I too am missing you a lot. More than me and the others, the person who misses you most is the Pani Puri man down the road. but I don't know whether in future it'll be there to serve you. But even if you could have it, fine. But with a lot of distancing, if you can, and that's the ball game. You need to have all that going so that you be safe. So, what happens next is you have to make it safe for yourself, safe for the patient, safe for the people around you, because you have a lot of responsibility. And the college wants you here so that your parents' aspirations totally completed and you also go further in your ranking and your study system. So, if you have an opportunity, please come back. The college is there to welcome you. Well, not everything changes so fast. Now that the foodies are coming back, it's a good sign. And everybody is happy. There's a little restaurant there for service. But then, it depends on what you eat. Because you need to boost yourself up. They say you got to get your immunity going up. Well, that is the truth. But then, there is a lot to scare about the COVID. How do we handle that? People say it is deadly. That means it is death-like. The minute you mention the name, you're gone. You will die. So with these two in mind, we have to understand a little bit of the gist of what happened. So it is an opportunistic airborne infection and spreads fast. Hence, breathing and talking can also put you in the bracket of a transmitter. So for these reasons that you've been asked to wear a mask everywhere and not cough. So you got to be extremely careful. So they have reasons for wearing a mask. And then most of the dental procedures generate droplets which fall on surfaces and contaminate, and then they become aerosols and float. Now, a little bit about the droplets. Dentistry is known for its droplet generating procedure, and then which turns into aerosol. So, what you got to know is the viral load in the mouth and the area, it is highly potentially dangerous. So, what you have to do to know is that all the aerosol that is generated, let's say, if it is size A particle, that would be a droplet. If it is smaller than that, A minus, then it is called a nuclei. And that can fall on the ground. So once that happens, in a period of little time, that can evaporate and float because of lack of gravity. So this becomes an aerosol. This can spread and to the distance of about 20 feet. So it can also enter the respiratory system. So these are the little issues, and once you get to know this, then you'll know why distancing is needed, why you need to wear a face mask, and why you should keep the surfaces very clean. Like I said, droplet infection, it contacts onto any surface, contact infection, and then it becomes an aerosol. So it spreads. Ultimately, you need to reduce the viral load. But in dentistry, we have a lot of procedures that involve production of aerosol. How do we go about it? These days, till some level of improvement takes place, you do not have to do these high-risk cases. So any procedure that brings about a lot of aerosol generation needs to be stopped. Or just in case you have to do an emergency procedure, you need to have good facial shield so that you are protected, the patient is protected, and general public is protected. So, how do we go about all these things? Like I said, these are little tricks. It is a game changer, no doubt, but you need to go about it so that things become a lot more easy. So, how are my friends, students doing in Kerala? I know there are a lot of them, but I do not know how many are watching. I definitely miss you, like I said, and I have people who are as far as Kottayam and Angamale and things like that. We have a lot of people in Mysore too. So I've got a quiz going on for you. I've got 4 questions for which I'll give you 1 minute to answer, and you can put it into the box. And you'll get a small little gift for the first correct answer. So the first one would be that I always carry a personal music system. It's pretty old, but very good. So I want you to name this little music system what I have. Can you see it here and there? Okay. Within a minute, have your suggestions, or if you have a chat box, go ahead with it. Okay. So the first prize gets a little gift, and that gift will come to you when you join the college. In the dental setup, aerosols are a common happening, and aerosol generating procedures are carried out in a large number of cases. Would you all agree? I think everybody on campus or in the dental specialty will definitely agree that this is happening. So the patients, nurse, healthcare workers, and the doctors need to be protected. Hence, you have to dress up. And dressing up, this is where a little trick comes in. See, a lot of people in a lot of parts of the world, you say that this is the best, this is the best. No, you can't be beating up so much of money. Yes, you need it, but at the same time, you have to make a little compromise, yet still be safe, so that you don't harm yourself, you don't harm the patient. And at the same time, you have a public perception too for the disease. Like some people might say, you need a shoe cover. Some others might not. They say, all right, no. So what happens is, if you are using a shoe cover, by all means, go ahead and make it compulsory, so that the patient doesn't have to say, no, he doesn't use a shoe cover, doesn't use a head cap. No, not to safe a procedure. No. If there is something going on, happening good, then yes, you think you can help, yes, do so. It's not that very expensive to procure all these PPEs, personal protection equipment. It's just a new game, a new fashion for dentistry, let's put it that way. Like I told you, a lot of new tricks, because you're not going to face or take the devil head on. Some little tricks here and there. And there are many of them. So, like they say, you can skin a cat in many ways. So, that way, you can slowly go about your practice. Start slowly. So that everybody benefits. It's a win-win situation for everyone. Because you will have to invest a little more in the clinic. So, what you got to do is separate the areas out. To dress up, you need some basic procedures and needed before the patient enters the operatory or the surgery. This is mandatory and it needs to be followed. And I think this is going to become the normal guideline, and it's not very expensive. It is not difficult to learn. There's a huge care and myth going on, but it's extremely simple. So all our sleeping days are gone. At least till we learn a few tricks. Yes, I do not know if people can walk around the streets like this. Such a happy picture, soon to be disrupted. No, these are some of my travel photographs and I can connect with them very well. So what happens is that you have two types of practices. One is a walk-in practice. That's what happens here in our parts. As you walk into the college, you need to answer a few questions. A questionnaire is given, temperature recorded, and symptoms checked if it's possible. Then go further in. And if you have to wait, make sure you wait in a safe distance area. Minimize the number of people who come along with you for treatment. Because the operator can't function that way. You need minimum number of people and you can't have so many people in the clinic. Like sometimes you say, my friend wants to watch the impaction being done. My friend wants to watch the filling being done. No, I think those days will go away. That doesn't matter. The friend can wait outside. If you're waiting outside, it's not going to be a very well done posh clinic, but a clean clinic. Gone are the days when you might have old magazines, old rusty magazines, if it's possible, which are totally brown in color, no photographs, no pictures, just a bare track, but very clean. You probably could have 3 rooms so that when the patient comes in, you will have to make sure that if the patient is going in for a procedure which generates aerosol or not. And by the way, when the patient comes in, I think these days it is very important that you use the toilet before he comes for a dental appointment. Even though the time is going to be quick and fast, you won't find patients floating around the corridors, walking here and there, and doing things on their own, going to the coffee shop, coming back half an hour late for the appointment. No, I think that is going to end. So what we have to do is sharpen ourselves. So what we got to do further is give them important documents to read, learn on the spot quickly, and tell them about the clothes they have to wear. Once that is done, you probably can move the patient inside the clinic. So the assisting nurse also dresses up depending on the procedure, and then before the patient sits, a mouthwash or formulated iodine, chlorhexidine is given, sometimes hydrogen peroxide too. All these are used. That's what I said. There's so much of myths about it. So one school says I can use this, the other school says you can use that. Third school says yes, you can use this also. So everything is documented and is supposed to be safe. Fine. We won't get into controversies here. And after that, it is sort of suctioned out, not spat out. So you must have good suction apparatus. I won't go into that in depth. That's a different topic altogether. But make sure nothing spatters all around the place. The clinical time should be as short as possible. And when it comes to spatters, you should make sure that nothing goes outside of the mouth. You have to keep it clean and wet, because they say that aerosols are of 2 types. One is the dental aerosol, what is generated by our drills and ultrasonics and things like that. And once it is swallowed and it comes out from the inside, it is supposed to be a medical aerosol. A lot of people say the dental aerosol is not too much of a contaminant. but nobody is going to argue about that. So when there are different schools of opinion, the thoughts are different, what do? You got to take precautions. That's why I said right in the beginning, these are guidelines which have to be followed because you're fighting an unknown enemy. It's the fear of the dark. So what you do is drop a few lines. Like the scenario might suddenly change. You might use a telephone or you might use a tablet. So the questionnaire can be sent to the patient because there are two types of appointments. One is walk-in, direct appointment, and the second one is a phone-in appointment. For a phone-in, you can do a lot of things on the phone. In the beginning or in the past, using a telephone or a tablet inside the clinic was a taboo. Your masters would catch you, no, keep the telephone out for a time. I could have done it. But right now, probably things will change because people will come by and they can call up the doctor. So the reception area should have a phone or a mobile or whatever it is, or a tablet, so that the patient can be communicated. The waiting room is not outside the college, but in the car park. So the car park is used as a waiting room. So when the doctor is ready, he'll again telephone the patient to come in. So at that time, all the work is being done right beforehand. Case history taken, everything is jotted down. So you're walking straight, and temperature may be recorded at the time of entry. And then hand scrubs. Yes, it's a must these days. Like I said, small little changes going a long way. So once that is handed out to the patient, goes right in, and depending on what kind of a procedure they have to do, will be sorted out as per aerosol generating or non-aerosol generating. Only two of them. So if you can handle this, things are pretty nice. Little alterations, like a new style of your jeans or a clothes. I think that should be all right. So you don't have to fear the dark, but then take a little evasive step so that you can come around. And that is going to be happening very soon. And at the same time, you must keep yourself utterly clean. The clothes you wear for the clinic is totally protective of you and the patient. And after each surgery, you must discard everything and the clinic should be cleansed. For at least 15-20 minutes, the clinic has to be cleansed. So, in a particular clinic, you will not have many people. Only the patient, the nurse, the operator, and a receptionist a little far away. And then what happens? Make sure if you are wearing the right amount of clothes, though a little heavy, yes, but you need to have all of them. Everything is disposable. Shoe covers, like I said, optional but nicer. General public first citizens, yes, they say yes, this is what we need. Head cap. Will you use a head cap? Will you use a shoe cap? All these things are needed. So it's a confidence booster. Might cost you a little money, but then confidence booster, still nice. So when you wear a mask, wear the N95 mask. So I'll play this twice. See how it is done. Like I said, all little tricks of the game. There. If you have not got it, we'll play it again for you. What? A slight innovation. I think it's easy to do it. These masks will come around soon. So you will be comfortable with it. So the lady has got all smiles. So you too can smile up and face the dental issues. There you go. So if you can handle things like this, it's just a little change. They are nice. And then you have a lot of dressing to do. That is the gist of it. You have to get ready, get dressed. It's no party time again. Everything, all the partying is going to be a little difficult. So you got to watch out what you do. How would you dress up? So before that, I've got the second quiz coming up. I am wearing a tie. As you can see, I don't know whether you can see the color of it. I want you to tell me which country this tie belongs. All I can give you is one hint. The country is called the Rainbow Nation. Nothing further. And in the end, when the college reopens, I will keep 4 gifts in the principal's office so that you can collect it from the office. At the same time, when I have to mention the principal's name, I'll have to thank our dean / principal, Dr. Ravindra, for all that he has done. Thank you, sir. Thank you, Professor Nandaman. Thanks for all that you've done. Thank you very much. Dr. Varun, thanks for all the help. Honestly, I see that. So, now, how would you wear it? So, first, wear on the gown. Then the mask or the respirator. Goggles or face shield. And then the gloves. Right? And then when you take it off, take off the gloves first, goggles or face shields, gown, face mask or respirator, and then hand wash. Hand wash, hand wash, hand wash. 3 things you need to keep in mind. Safe distance, yes. Like I said at the beginning, don't go close to anybody, 3 feet or 6 feet away. Then mask, you have to wear it. Whether you're mowing the lawn or walking to the coffee shop, you must have. And then scrub any surface. So SMS, that's the motto. So I'm not going to each kind of a thing of the mask or shield, but there is something called the N95 mask, which filters about 95% of the particles. And then to get more protection out of it, you probably will have to use a respirator, which is also allowed. And if you think you have a splatter, make sure you have a visor or a face shield. And everything is here, waiting for you to come back to practice. And that's a good sign. So you need to cultivate to use safe workplace practice to protect yourself and limit the spread of contamination. Can you handle that? With all this, it is possible. Perform hand hygiene between steps if hands become contaminated and immediately after removing all PPEs. So, make sure that you keep some hand wash material ready. The minute you put your hand out, that's the only thing should come to you now. Nothing else for some time. After that, can you just send the patient away? No. You have to just hold on a little. Patient is removed by the assistant. Patient is guided towards the reception. Guided. So he still needs to be protected there. Then the procedure and the prescription are informed to the patient about what's to be done for the future. And the patient again performs the hand hygiene. Then is given the follow-up instructions. So like I said, these are little steps you need to take to prolong all the stages. Hence, it is going to be a little time consuming. That's the reason you have to be quick. Cultivate that quick working habit so that things become a lot more easy. So, make sure that everything is discarded into a hospital waste, which is taken off. After that, you need to spend about 15 to 20 minutes disinfecting the place. You'll have to fog, hypochlorite, and then you'll have to wipe. Alcohol-based. And at the same time, make sure the windows are open so that air is gone out. If possible, a fan is kept behind you so that it is blown out. So in this way, each patient turnover, you will be practicing only about, I don't know how many per day, but after each patient, make sure it takes about 15 to 20 minutes to clean up the place for the next patient. So till that time, the patient waits outside or in the car park. Choice is yours. So, disinfection protocol, like I said, yes. General chairs with auxiliary parts with not povidonitis, your alcohol. Immunity is a balancing act between the viral load and the good immunity you have. That is important for your survival. It's a balancing act. So for the patient or anybody, all of us, good oral hygiene measures. Probably brushing twice earlier, the free time. Keep your mouth extremely clean. Use mouthwashes. Clean your personal mask. Because the other day I went to a showroom somewhere and a lady comes out with a mask so colorful, I didn't know where to look. I said, what is this? I didn't ask her though, but still, I heard later on that they make a lot of cleaning of your personal mask. So, hot water is good. Wash it up with soap and hot water every day. That should be fine. And practice SMS. Safe distance, mask, and scrub stuff. Cleaning, that's the job. And then what happens further? For the patient, reduce the oral viral load. Antiseptic mouthwashes, betadine, chlorhexidine, hydrogen peroxide. Use them. You have to be very cautious when you suction. Use a good suction so that everything is taken out and the patient doesn't fall. Make sure that nothing goes down to get a cough out of the patient. And make sure, tell the patient not to swallow the mouthwash and the other irrigation materials. Important because some of them get a little cough and aspiration going, which is not good. At the first time it doesn't happen, but then over a period of time, things are not too good for the patient and for you also. So, try and avoid a few little things. Using mask, a surgical mask, what is available in the clinic, the free-layer mask, should be sufficient for non-aerosol generating patients. And if you think that it's an aerosol generating mask or procedure, then you'll have to change the mask into an N95 or respirator, which are available. A lot of clinicians are using it. They're pretty safe. So use them well so that you are safe, the patients are safe, and everybody's happy, and there is a win-win situation happening all around. Now, how to boost immunity? Why am I talking so much about immunity? Because the whole world is raining around immunity. So once that is down, everything is down. Would you agree? You may or may not. So, physically active, exercise, yoga, meditation, all those things. Pranayama, okay. Anybody into yoga? Fine, go ahead. Eating right. That's a question mark. Mediterranean diet. Well, would you think olive oil would save your life? I don't know. That it saves your pocket. I think that's what is needed. And a lot of people you go in for coconut oil and soya oil. I'm not a person who would comment on anything. But as long as that does you good, enjoy it. Stay hydrated. Oh yes, fruits, vegetables, fish, and whole grain. Wow, that's nice. I think I showed you a picture of the fish. That is pure English fish and chips. You will enjoy it. You will enjoy it. That's the whole preparation to make it. Probably some of you might be making it also for lunch today. Enjoy it. And the name of that is haddock. That's the fish they use generally. Have good night's sleep or get a lot of sleep. Keep your mind active. Read a lot of books. Social distancing. Use the telephone a lot more. I hope the prices of telephone calls have come down. So get into video conferencing, talking to others, learning about smoking, alcohol, and addictive substances. Yeah. So this is just to keep you positive in times of these. So if you think you can handle it, it's nice. So like I said, nothing much will change because whatever is given in the textbook will remain the same. But at the same time, make sure the principles won't change much, but slight amount of technical changes will be there. So if you can adapt to that, and it doesn't take much time. It just doesn't take much time. So just practice a little, just practice for a few days, weeks, and things like that. Things will happen. It'll come into place because this is going to stay the norm for, I think, quite a while, or I don't know how long. So we need to be connected. So looking back at it, let's take up each department a little by little. Yes. Now, I have a little pen in my bag, which I carry. Third quiz. There it is. You need to tell me to which country this pen belongs to. You get a prize. Honestly, you will get a prize. Okay? Okay. Now, individual speciality. If you've gone to this place, it's nice. It is Venice. Oral medicine radiology. Yes. Your history must take travel and occupational information during the time of screening. These days, we travel, a lot of travels here and there. So what do you happen? So people coming there, here, everywhere, count goes up. So everybody turns it to a red zone. More number of positives, zone becomes redder. So I think it's nice to limit that. Intraoral exercise can stimulate saliva secretion. So if it can be avoided, here some tricks are found out, please avoid. So what can be done? Use extraoral dental radiograph, panoramic, cone beam CT, all this can be done. Intraoral exercise also stimulate coughing, which is not required. Like I said, coughing, yes, transmit, aerosol, medical aerosol, or dental also. One cough is gone, boom, whole world shuts down. So you can't even cough, can't even sneeze. So that's where we are now. Somebody will come around. Like I said, everybody is going to come around. So this is for oral medicine. Periodontics, yes, Professor. There in the corner, yes. So let's see what we can do. Patients, the little ones, they come, they need a lot of company around them. Not because they want to play there, but they need to be under check and under control. So a lot of people come in, mothers, fathers, uncles, aunties. I've also got to bring a patient on Tuesday. So, but I'm staying out, sir. So that's what happens. Aerosol generating procedures and extractions in children with behavioral disability should be deferred. At the same time, make sure that nitrous-oxide inhalation techniques are not used. Just stick to what can be done, because it's extremely difficult to control the child on the chair. For a child, yes, but on the chair, oh my God, yes, it's going to be difficult. So, till we tide over a little more, till we get our bearings a little more right up, then I think we need to adapt to these situations. Okay, maxillofacial surgery. We are going back to school. All the aerosol generating procedures are sort of shut down for the time being, or I don't know whether it will reopen again. And then, I do not know if any of you have used a mallet and scissors. You can use all those things. Osteotome, yes, very helpful. So, what you got to do is, in your school practice, make sure that you learn to use all this. The teachers are there, they will teach you how to use all this. Aerosol generating surgical motors and high-speed drills to be avoided. Scalpels of monopolar diathermy and mucosal incision. So these are a lot of cutting tools, heat generating tools. A lot of them. There are a lot of controversies also happening that this is better than that, that's better than you have to throw your scalpel away. But I think the scalpel still stays there. Avoid repeated suctioning and irrigation. So make sure that it's safe for everybody, safe for the operator, patients, etc. So because once the infection sets in, or something positive is noted somewhere, the whole village, town, everything comes to it. Even though it may not be a total scare sometimes, but like I said, the people's perception is going to be very high. So try and avoid all these little tricks which are not necessary for your practice. Learn the tricks which are helpful. So if you're not going to use aerosol generating technique, use a hand cutting instrument. With your chisel, mallet, osteotome, things like that. Please use them. A little difficult, but you can learn. Prosthodontics. Therefore, elective treatment procedures. Crown bridge on this, which involves generation of aerosol. It's like aerosol is the culprit everywhere. Like I told you right in the beginning, aerosol, the dangerous sugar. How they're generated, I told you. I told you what it does. I told you also how it goes about doing it. So once you know that mechanism, you'll be safe. Safe in the sense that you will infect others also to obey the norms. So now that you know aerosols are dangerous, you will try to avoid it or you try avoiding generation of it. So that's the safe point. Impressions and cars should be thoroughly disinfected for handling. Would you agree on that? Yes, all norms of good dentistry. Like if you go behind a lorry sometimes, a transport lorry, and when you're following it in your car, you suddenly read a signboard saying on the back of the lorry, keep distance. Well, they've been following it for a long time. Only thing is we haven't done it. So now we have to do it for the safety of one another. So I think these are not very difficult to handle. So again, you all can come back, enjoy yourself and myself, learn, and learn. There's a lot of things to be learned. And that also can be done. It's easy. All you have to do is learn. Orthodontics. Treatment should be restricted to trimming and adjusting of the wires. Beyond that, no. If there is anything more than that, simple pliers should take the appliance out without any fuss. So that is to be done. So with this, I think I have come to a close conclusion. So we have one or two departments left, and that is periodontology. Okay, again, your happy days are gone. You'll have to scrub again. Your hand instruments, they're going to come back again. Surgical care to be provided only to people who are at risk or in emergency cases. Because some countries, right in the beginning, shut down practices totally. Some countries said, no, you can carry on with your practice, but treat only emergency cases. But then, some of the countries said, no, we're not bothered, we are continuing our practice. Well, that's it. So, when you're not sure about what's happening everywhere, it's better to be safe. So these are safe guidelines which can be done. So once followed, it becomes easier. Now within a month or two, this becomes normal. So there's no need to worry, there's no need to panic. You'll come back and start studying, learning, earning, and making merry. Resume merry, but with SMS in place. So make sure that everybody around is safe. Conservative, wow, again, aerosol generating. But emergencies, you require it. You may or may not need it, but then sometimes here and there. But you are expected to totally abstain from it. Aerosol generating procedure. But then little goodness is there when you can use a micromotor. At the same time, you can use for excavators for restoration. As long as you don't generate aerosols or droplets, which cause all this aerosol business, don't go near it. Whichever department, whatever you're doing, I think your high turbine, handpieces, and aerosol generating surgeries and instruments are going to be shelved for some time till things are getting better. Thank you. This is my singing group in Manipur. We were called the Early Sunset. But I hear that your staff members are also singing, and I had a clip of them singing too. Lovely. All 10 of them, or 15 of them, how many saw? 20 of them. I saw the clip, thoroughly enjoyed it. And Dr. Kushalappa too will be singing soon. Thank you very much for wherever you are. Thank you very much, and good luck to everybody. Be safe, stay happy. See you here soon. Thank you very much. Thanks for this. Good afternoon. And there is a last. I have to tell you, like everybody does. This watch is about 70 years old. This belongs to the father. Okay? I'm not in the position to take it out right now because of the old mechanism. So, it is 70 years old, still running, on time, and the time now is about 12:10 or something like that. Yes. So, this is it. And I want you to tell me the name of the company of this watch. So there are 4 prizes to be won, and please let your answers go to the Dean's office or the chat box or whatever it is. The first caller or first person who wins gets the prize. And I'll tell you the prize also. It is a little notebook, not to write the phone number, but to write the procedures you would be doing in future. So this acts like a logbook. So you can add up on that, and for the future, it can be a big logbook forever. But it's going to be a small little book which I give you, but I'll tell you it's going to be worth it. And good luck to you, and I'll see you soon. Thank you very much from all of us. Good day. Thank you, sir.
Highly motivated. Thank you, Dr. Cariappa. On behalf of JSS Academy of Higher Education, we'd like to thank you for your highly motivating talk and putting it in a very interesting package with a meal on every slide. I'm sure needs a relaxation and taking things in life than to get tensed and be run away or stay in. Of course, today's lifestyle is to stay in, safe at home, but as of uh, frontline workers and healthcare providers, and in particular in dentistry, which we all know and everybody knows too, that it is very, very high risk for us to work. But then all said and done, the moral motivation, which as well as the standard advisories have been made to follow, starting from wearing a mask as well as the PPE. So we will have 2, I would say, Lord Shiva's avatar, having one side inner self of us and the other half being of PPE, and try to deliver the best. I hope each one of us have this both roles in and still deliver what the Lord does for all. And this way, I'm sure that steps which we are following in this JSS, as you narrated rightly, are in place. And I'm sure all the faculty who are already in this college waiting and started treating the patients would feel they are safe as well, and they are practicing. It took time, but a year now, they all are really geared up, and they are attending and treating patients already in all the specialties, whatever emergency based protocols, which are stage wise. We are moving ahead from the last 3 weeks. And as rightly said, the isolation clinics, special clinics, as well as proper disinfection systems have been introduced, which were always a part of our institution because we were ISO certified and NAAC certified, and all these place systems were in place, and now they have become much more stronger, and we adopt the systems in place after every case being treated on the every chair. However, right now, as we have limited chairs in use, so we are using those, and we have increased our hospital OP already patients have started pouring in, and what we started as 2 clinic setting has now become 2 clinics in each department setting, which is operational, and we are looking forward to increase them further. I'm sure your talk has been highly motivating students and eager to come back and learn how to practice safe dentistry.
Thank you, sir. Thank you very much.
I would request all the participants to type their questions in the Q&A box.
I'd like to thank again Dr. Cariappa for having come and given the motivational talk. I would also say that it was very interesting that to hear the way of demasking and storing in a container than putting into covers and disinfecting the container. And I would also like to say that as JSS Dental College has fully geared up, and already what we started as 2 clinics, so now every department 2 clinics, and we are going for another 2 more, so which will be ready to providing service. And I would say a lot of patients have started already pouring in and getting the emergency and urgent care services. All the faculty have been geared up, though we were initially, getting to know and do the practices which we were always doing, because we were ISO certified long back and many SOPs are in place. We had to just build it in a practice and a checklist and follow that, reduce the movement around the operating area, and deliver the best, and let us practice safe dentistry. I'm sure you will be back soon to follow and learn and practice safe dentistry. I thank you again, Dr. Cariappa, for making this possible and highly giving a motivational talk to our dear students and friends and colleagues. Thank you.